All right. Well, thank you and welcome everyone to the first session of the Pharmacist and Pharmacy Technicians as Cancer Prevention Champions series. On behalf of the American Cancer Study, I want to thank you for taking time out of your busy schedules to join us today, whether that's live or via recording in the future. Today's session will focus on HPV vaccination facts and communication strategies. If you want to go to the next slide. So I'm Ashley Locke, HPV Program Manager working on our disparities programs at the American Cancer Society. I have the honor of moderating today's session, but I am a part of a much larger team that encompasses many colleagues from the American Cancer Society who work on increasing HPV vaccinations every day. Next slide. So we would love to get to know all of you. So in the spirit of Thanksgiving, please take some time and write your name, organization, and what you're bringing to Thanksgiving dinner via our chat. And we will look at those shortly. If you want to go to the next slide. So while you guys are sharing in the chat, I am going to share just a roadmap for today's session. So right now we're reviewing a few housekeeping items. Soon you'll hear from our presenters, Erica Thompson and Chantel Parker, followed by Q&A, and then we'll wrap up with a few remaining resources. I do want to share a quick few reminders. So this session is being recorded and will be posted to a public-facing website. The session is certified for continuing education. We've added a link to the chat detailing out information for live continuing education credits. For continuing education purposes, I would like to share the following disclosures. Erica Thompson receives consulting fees via the advisory board, has contracted research, and is a part of the Speakers Bureau for Merck. Additionally, Chantel Parker is an employee of Walgreens. None of the other planners or speakers involved with the HP Vaccination Pharmacy series have anything else to disclose. We ask all participants to stay muted until our Q&A. However, the Zoom chat is open for comments, questions, and any support that may be needed. Next slide. We are going to start today's session with just a quick poll to see where everyone stands with HPV knowledge, how confident you are recommending the HPV vaccination series, how often you are recommending the HPV vaccine, and how confident you are around the HPV education and addressing vaccine concerns. So please feel free to take a minute and to share your knowledge with us. Taylor, Hannah, what is the poll uptake right now?
We have about 13 responses. Maybe just another couple of seconds.
Perfect. For anyone just joining us, we are doing a quick poll just to gain some knowledge on your guys' knowledge around HPV vaccines. As well, if you're just joining, you can share your name, organization, and what you're bringing to Thanksgiving via the chat. So appreciate everyone that's done that so far. Looks like we have a couple of people bringing appetizers, some desserts. Chantel's going to be bringing turkey, so everyone go to her house. Um, Daniel's going to be bringing an appetite, which I really love. So lots of great things. Would love to hear from a couple more individuals.
Okay, we're at about 18 responses, so I will go ahead and end the poll and
Perfect.
share those results.
Perfect. It looks like for describing knowledge of HPV vaccines, majority were moderately knowledgeable. Feeling confident in recommending. It's kind of all over the board, but it looks like quite a few of you are strongly agree or agree, and then the other half are neither agree or nor disagree. routinely recommending the HPV vaccine to customers. Majority are kind of neutral, although we do have some that do regularly recommend the vaccine. Feeling confident about educating parents about the HPV vaccine. We have some that disagree, quite a few that are sort of neutral, some that agree, and some that strongly agree. I'm feeling confident addressing concerns. We have quite a few that don't agree with that or are neutral, and then some that agree and strongly agree. So thank you all for participating in the poll and for sharing your knowledge with us. We are going to be doing another poll like this, so get prepared for that. But in the meantime, we can go ahead and move forward. Um, so for today's session, we will be focused on the following learning objectives. We're going to be discussing the importance of the HPV vaccine, identifying key points around HPV infection, related cancers, and vaccination rates. And then we're going to describe communication strategies for HPV vaccination. If you want to go to the next slide. Before I introduce today's presenters, I thought we could start with just a quick survivor video to show the importance of why the HPV vaccination is so important and impactful. We hope this story will offer all of you a personal and emotional connection to the impact HPV cancer has on survivors. And hopefully this story will help combat stigma, inspire some action, and encourage preventive behaviors like vaccination and screening. So, Hannah, feel free to share.
The sense that I had cancer and I just didn't even really know where I was going or what the sense that I had cancer and I just didn't even really know where I was going or what was going to happen was the most terrifying. When I sat down with doctors and started talking about what it was and what we were going to do, regardless of the outcome, I didn't think about that. I thought about the plan and what I had to do to get through it. My name is Frank Summers, and I was diagnosed with HPV-derived squamous cell carcinoma in my left tonsil when I was 45 years old. Well, having cancer impacted every part of my life really significantly. Of course, I was young and in great health and never really had a problem, and all of a sudden I'm dealing with cancer. And so emotionally, that was an incredible blow to feel like I wasn't a young, healthy man anymore. Physically, it was incredibly profound. Lost weight, lost strength, lost focus, ability to do things. It was a real struggle. If I had 30 seconds to send a message to everybody in the world about HPV, I think it would be, well, it would simply be awareness. It would be to say you need to realize that this is a problem out there, and it's a problem that we can't be shy about or uncomfortable with. It would be it's a problem that everybody and anybody can have, and the consequences are huge. I've had a number of friends with children as a result of me who have decided to get educated about it, have become aware of the problem, and then have gone and vaccinated their children. To me, I can't think of any reason why you wouldn't do it at all. If you could vaccinate someone and potentially eliminate what I went through, it wouldn't be a question.
Perfect. Well, without further ado, I'm happy to introduce our speakers for today's session. Erica Thompson is an associate professor at the Department of Quantitative and Qualitative Health Sciences at UT School of Public Health in San Antonio. And like I shared before, her disclosures are she does receive a consulting fee, she has contracted research, and she is a part of the Speakers Bureau for Merck. And then Chantel Parker is healthcare specialty supervisor at Walgreens, and Chantel's only disclosure is that she is an employee at Walgreens. So I will now pass it along to Erica.
Thank you so much, Ashley, and thank you all for the chance to talk about HPV. And we're going to start with kind of an overview of HPV and HPV-related cancers before we transition into discussing some of the communication strategies. So next slide, please. So to start out, what is HPV or human papillomavirus? Well, this is a very common virus. There are over 150 different subtypes of this virus. So you'll hear different numbers thrown out like 16, 18, 6, 11. But about 15 of these types of HPV can cause cancer and precancerous symptoms. And that's why it's such a major public health concern. There are also types that can cause genital warts, but for the purposes of this presentation, we'll be focusing on the cancer. Most people will be infected with at least one strain or type of HPV at some point in their lifetime if they've had a sexual partner. And typically that occurs around the young adult period, usually by age 21, because that's when people are first engaging in sexual activity and when those new infections can occur. So around 50% of those infections occur among young adults. That being said, while HPV is so common, most people can have their immune system fight off the infection. So most infections will go away or be suppressed by the immune system and go away within 2 years. It's those infections that persist and continue, which can cause more concern related to cancer. Next slide, please. And so thinking about the population impact in terms of HPV, as I said, very common virus, but most infections we don't necessarily need to worry about. But there are infections that persist and can lead to some of the health outcomes described on this slide. So if we think about kind of a pyramid or an iceberg, at the bottom of that, in terms of the most common outcomes that we see, are about 2 million people with a cervix can have an abnormal pap smear or positive HPV test for cervical cancer. So this is indicating abnormal cytology or changes in the cervical cells that could potentially, if not intervened upon, lead to cervical cancer issues. And we'll talk a little bit more about some of the outcomes associated with abnormal pap smear as well. About 1 million people are affected with low-grade cervical dysplasia, so kind of that progression of cervical disease. Over 350,000 people in the US are affected by genital warts, which has its own level of morbidity associated with that outside of cancer. 300,000 with high-grade cervical dysplasia, and about 37,800 HPV attributable cancer cases per year in the United States. That's about the size of a baseball field of people attending a baseball game. Next slide, please. So I talked about at the bottom of that pyramid that the implications of an abnormal HPV test or abnormal pap smear for people with a cervix, most commonly women. And we're talking about over 2 million people. And many of you may know someone in their life who've experienced this and know that it does require some next steps in terms of additional testing to understand what type of abnormalities may be present. And those subsequent tests can include things like a colposcopy with biopsy or endocervical scraping or cone biopsies. Now, all of this aside, there are the emotional and psychosocial consequences associated with having an abnormal test. There's psychological stress about worrying about a cancer diagnosis and the unknowns of what happens next. The stress in terms of being in between those follow-up periods. There's also the physical consequences of discomfort of these procedures and biopsies. And then the financial consequences of time off of work, going to your medical visits, recovery time, potential co-pays. So this has significant implications in terms of having an abnormal HPV or pap smear. Next slide, please. And then back to the top of the pyramid. So we go from kind of that detection or screening of potential cancer, at least for cervical cancer, to the top of those who are diagnosed with a cancer. The most common cancer being oropharyngeal cancer, as as we see on the bottom, most commonly among males. But HPV can cause 6 different types of cancer. It can cause vaginal, penile, vulvar, anal, cervical, and oropharyngeal cancer. So we most often think about cervical cancer, but it can also affect these 5 other types of cancer, with around 37,800 people affected each year. Next slide, please. And we really want to emphasize that HPV can affect both genders. Early on, this was a feminized virus and because of its connection to cervical cancer, but we're seeing an increasing incidence of head and neck or oropharyngeal cancers among men. As I mentioned earlier, this is the most common HPV-related cancer, more common than cervical cancer now. And there are about 15,200 cases per year, again, predominantly among men. And so if we look at this figure on the screen, it's showing the different trends in terms of incidence of these HPV-associated cancers by different sites. And I'll point out at the top, you see oropharyngeal cancer in that purplish color, showing that significant increase, whereas we see a significant decline in cervical cancer, indicated by that green line. What makes oropharyngeal cancer more challenging to prevent compared to other cancers is we don't have a screening test available. There's no easy clinical endpoint like we have in cervical cancer progression to know when we should be screening and to have that early detection to then prevent subsequent progression to disease. And this ultimately results in more of a late stage diagnosis. Next slide, please. And this really underscores that many of these HPV-related cancers don't have a routine screening test available. Cervical cancer, we have pap smears and primary HPV testing that can occur for people with a cervix. But for the remaining 5 HPV-related cancers, there's no approved or recommended routine screening mechanism. So that's why vaccination, as we'll learn here in a moment, is so critical in terms of primary prevention. Next slide, please. And so the American Cancer Society really wants to protect children today from developing HPV infections, pre-cancers, and cancers in the future. And that protection for today can happen through HPV vaccination at an early age. Next slide, please. So typically it is a 2-shot vaccine series. We'll learn a little bit more on the next slide, but these 2 shots of the HPV vaccine can help prevent 6 types of cancer. Next slide. So to give you an overview of the guidelines, it's important that we vaccinate boys and girls, men and women. On-time vaccination is typically between the ages of 9 to 12. And if a child gets vaccinated during that window, they only need 2 doses at 6 to 12 months apart. Now, an adolescent age 13 to 14, a little later can still occur. It's still 2 doses. And if someone is still not vaccinated between the ages of 15 and 26, it would be 3 doses because they need that extra dose for immune protection. And that would be the first dose, second dose at 1 to 2 months, and third dose at 6 months after the first dose. Next slide, please. And so when we think about the role of pharmacists and pharmacist technicians and your interactions with patients, and our role in cancer prevention in Texas as a whole, there are 2.2 million 10 to 14-year-olds in the state of Texas. That's actually 1 out of 10 children are here in Texas. So we have a strong group. We have a large group of people that we can impact in terms of cancer prevention. Next slide, please. So there's a lot going on this slide, and I'm going to break it down panel by panel. But we want to look at where are we at in terms of HPV vaccination in Texas. And if we start on the left-hand side in that first column, nationally, about 61% or 6 out of 10 kids are up to date on their HPV vaccine series. That means they've received either 2 or 3 doses depending upon their age. Unfortunately, only about 27% of those youth are getting up to date by the age of 13. So that means we have some improvements to do in terms of on-time vaccination. Unfortunately, Texas continues to be toward the bottom of the state list. 57.5% of our adolescents are up to date on their HPV vaccine series. So we have a lot of progress to make, and that's why engaging multiple healthcare professionals is so important in terms of increasing those rates. And to situate that with other adolescent vaccines, if we look at the middle panel and compare to meningococcal ACWY and Tdap, where about 85% of adolescents are up to date on those vaccines that are recommended in adolescents as well, we can see we need to make a lot of progress in terms of HPV vaccination to mirror those other adolescent vaccines that are recommended in the same age range. We also need to be intentional as well around disparities that may occur with this vaccine series. We see geographic disparities where there's higher vaccination rates among urban populations, around 55% compared to 50% for rural areas. And we've traditionally seen a gender disparity, although that gap has been narrowing over time, where females are more likely to be vaccinated than males. That has to do with how the vaccine was introduced initially, but this is a vaccine for all genders, and we need to work on narrowing that gap. Next slide, please. So I want to cover some important facts to think about when it comes to HPV vaccination. And I think the first important fact is that the HPV vaccine is effective at preventing cancer. And to help describe that on the next slide, please, we'll look at some of the evidence related to that. We have a study that has demonstrated in the United States among women ages 20 to 24 who were the first cohort to receive the HPV vaccine and to kind of see the potential for prevention, a 65% reduction in cervical cancer incidence in rates from 2012 to 2019. Next slide, please. And these figures help describe this even further, where we've seen this decline in cervical cancer incidence rates among women and occurring across different race ethnicities. So in the top left figure, you're seeing for all race ethnicities, that decline happening around year 2012, where that age cohort is aging from the first introduction of the vaccine in 2006 to see the potential effect of that vaccine for cervical cancer incidence. And we see similar trends occurring for white, Black, and Hispanic women as well. Next slide, please. And we even have more robust evidence occurring in European countries. In Scotland, they have just produced the exciting news that they've had no cervical cancer cases since the introduction of their immunization program for 12 to 13-year-olds in 2008. Similarly, we're seeing success in the United Kingdom, who've almost completely eliminated cervical cancer in England. And Sweden has also demonstrated significant progress in terms of their cervical cancer rates, with only 2 cases found among those in a vaccinated cohort compared to 538 in an unvaccinated cohort. So the evidence is very clear. This is an effective vaccine. Next slide, please. And it's important in order to boost that effectiveness to think about the immunity and when we get the best protection from this vaccine. And it works best when completed by age 13. There's a stronger immune response at younger age groups. And it can be paired with well child visits at these times as well. And it's really the best protection in terms of these HPV-related cancers. As I mentioned earlier, there's no screening test for 5 of the 6 cancers. And vaccinating early is important in order to provide vaccination prior to any type of exposure. There's also been long-lasting studies to demonstrate the effectiveness of these vaccines beyond what I've already shared. And these studies indicate that there's no sign that a booster dose is needed beyond the initial vaccination series. Next slide, please. So the second key truth or fact that we wanted to share with you is that the HPV vaccine is safe. So next slide, please. And to help support that fact, there have been 109 studies of 2.5 million people in 6 countries that have shown no serious side effects other than what's typical for all vaccines, such as an allergic reaction or fainting. So this has demonstrated the safety profile of this vaccine. Next slide, please. We also benefit from a robust multi-layered safety monitoring system for this vaccine with over 15 years of data. And there have been over 135 million doses in the US and 500 million doses worldwide. Up until COVID, this was the most widely studied vaccine in terms of the safety profile. Next slide, please. And we continue to evaluate and monitor the non-valent HPV vaccine safety in the United States through systems like VAERS with the clinical review of serious reports and adverse events, through vaccine safety data link, looking at pre-specified outcomes, PRISM with active surveillance, and manufacturer post-marketing commitments with 2 10-year studies to look at the long-term safety profile. So all of this should demonstrate the safety profile of this vaccine in addition to its ineffectiveness that we previously described. Next slide, please. And I know many people maybe have heard from a peer or someone that, hey, I heard this this vaccine causes XYZ. And we often hear many myths about the potential or hypothetical dangers of the HPV vaccine, but these aren't true. And each time a concern is raised, it's been thoroughly studied by scientists and government agencies through those mechanisms that I've shared previously. And over the past 13 years, there is no increased risk of some of these conditions that have been brought up that are kind of appearing on this slide here, such as autoimmune disorder or multiple sclerosis, as well as 60 other different conditions. This is a safe vaccine. And again, one of the most studied vaccines that we have. So I just really want to emphasize that point. Next slide, please. And so before I turn this over to Chantel, I want to leave you with these 6 key facts that we've covered so far. The HPV vaccine is cancer prevention. It is safe and effective and for all children. And it's best when given early between ages 9 and 12 and can prevent 6 types of cancer. So I'll now turn it over to Chantel to carry us on.
Awesome. Thank you so much, Erica. In hoping that we now feel a little bit better for those who are kind of middle of the ground in the morning poll or the poll we started off with, just hearing a little bit more about the facts, recommendations, and overall safety. So next question is, so what do we do? And this is geared towards our pharmacy professionals, so both our pharmacists and pharmacy technicians. And we know that making a strong recommendation makes all the difference when discussing with our patients. So we're going to get a little bit interactive. So hopefully you've kind of got the chat open and can answer some questions because I'll start throwing a few out there. Next slide, please. So why pharmacists? We know that pharmacists are still the most accessible healthcare providers. At this time of year, we know that patients are in our pharmacies day and night. They're getting their respiratory vaccines. They're already there for flu, COVID, maybe RSV. And it's a great time to recommend all vaccines, catch-up vaccines, and specifically the HPV vaccine. So 91% of the US population lives within 5 miles of a pharmacy. So that's a great fun fact. We have extended hours, so after hours, evenings, weekends, which adds to the convenience. We have shorter wait times than doctors' offices, and they can often get in to see us as opposed to waiting months before seeing a doctor. And then we know in some rural areas, patients have more access to pharmacies than they do to medical clinics or public health clinics. So pharmacists can be the difference in a patient receiving a life-saving vaccine or not. And we know that rural populations are less likely to be vaccinated and have higher rates of HPV cancers. Again, we are a trusted healthcare provider. Patients are getting those vaccines right now. And at least 31 to 44% of parents are willing to get an HPV vaccine for their child at a pharmacy. Next slide. So let's look a little bit further and see what is some pharmacy authority. So without cheating and looking at the slide, does anybody know in the state of Texas, what authority pharmacists have to administer the HPV vaccine? It's a little pop quiz. I'll give it a second. And this session is geared more towards Texas. So we'll take a look at some Texas specifics. But as you can see across the nation, the pharmacist authority varies between having that independent authority and being able to give it, or having some collaborative authority and having to give it with a under a protocol. Yep. So we have Daniel, 14 and up, Megan, 14 and up under protocol. And we'll dig a little bit deeper on the next slide. So while we saw that the majority of states allow vaccination either under that pharmacist authority or under a collaborative authority with the physician, the spread in what that age limitation is a little bit difficult. So we heard Texas highlighted in yellow, over 14 years old. Younger ages can be administered the vaccine under prescription protocol. But some states, it's 18 and up. 15 have no age limit. I thought that was extremely interesting. So just kind of reviewing where we are and what the kind of spread is through the various states on pharmacists administering HPV at the various age levels. Next slide. So the CDC immunization schedule here shows that in purple, between 9 and 10 years old, all children in this age group can get the vaccine. And then in the deeper purple, kind of more indigo, you can see that it's all children in this age group should receive the vaccine. So kind of, can versus should, and thinking through that clinical judgment piece as a pharmacist. I'll throw an extra credit question out there. In the state of Texas, at what age can we administer the vaccine to a 9-year-old? Do you know? Oh, I gave you the answer in the question. Sorry. The question was, with the script, at what age could you vaccine down to? But the answer is 9. So in the state of Texas, you can work with a patient's provider and get a script at age 9 to give that vaccine. I'm so sorry, you guys. Next slide. I'm sorry. It's 11. So sorry. Okay. Talking about HPV vaccination, let's take a look at the CDC immunization schedule. After that schedule, you want to be able to educate yourself and then look at talking about it confidently with patients. So you always want to lead with cancer prevention. Erica talked about that, I think, in depth. It's so common that it's far more important to discuss why to vaccinate than how it spread. We know that preventing cancer is a strong motivator. We want to normalize the HPV vaccine You want to use an announcement approach and a presumptive approach. You want to connect with patients. So use personal stories. I know when I'm talking about it to people, I always discuss my kids who are 11 and 15. They've both been vaccinated. I talk about my story, how difficult it is for that follow-up vaccine to get back into the doctor's office. So maybe, getting a prescription from the provider is better. Discuss all recommended vaccines with patients so they understand that you're a safe space. And then also remember that the goal of the conversation is action. So you want to create an action plan for next steps that includes follow-up. Does anybody have an idea of a presumptive statement or an example of a presumptive statement you've given to patients in the past to kind of help them through the vaccine journey, whether it's HPV or any other vaccine? Give everybody a second. And then we'll move into the next slide that has a few examples of what those presumptive recommendations can sound like. So next slide, please. All right. So how to make an effective recommendation. This patient is 9 to 10 years old. We have all of the patient's information there. So the delivery breakdown is to be presumptive and reasonable. You want to talk about HPV vaccine just like it's any other vaccine, and making sure that patients really understand that cancer can be prevented in boys and girls with the HPV vaccine. So Max is 9 years old, which means he's due for his first dose of the HPV vaccine. I can call and get a prescription from his doctor so he can be vaccinated today. This vaccine protects against 6 types of cancers. So you don't really leave a lot of room for an open-ended question. You really are kind of educating them already under the assumption that they are going to be able to vaccinate their kid that day. I'll tell you, at the doctor's office, they just, they use presumptive approaches all the time. And you leave, and before you know it, your child is all caught up. So we should do the same in the pharmacy. All right, let's look at the next slide. How would you make that effective recommendation to a parent of an 11 to 12-year-old? All right, Selena is 11. She's now due for 3 vaccines. These vaccines prevent against meningitis, HPV, cancers, and whooping cough. We can contact your provider to get a prescription so she can receive these vaccinations today. Again, very clear, taking that presumptive approach and assisting the patient getting caught up with not just HPV vaccine, but also whooping cough and meningitis, which we know our kiddos need to go to middle school. And finally, sparking that conversation with a parent of a 14-plus-year-old. So our records show that Juan is 14 and is overdue for his HPV vaccination. This vaccine protects against 6 different types of cancer, 3 of which affect men. We can provide that vaccination today. I think this is excellent because, as Erica mentioned before, there's this, stigma that maybe it's, only for girls and not boys. And this breaks it down, giving the facts that 3 of those cancers affect men. And we saw that in our patient video as well as we got started today. Next slide. So what do you do if a patient or a parent is hesitant? How many of you can say just thumbs up or reaction that you've had a patient with some vaccine hesitancy and you've had to kind of calmly talk them through that situation? Anybody there in the chat? Yes. Okay. Thank you, Daniel. All right, next slide. So if a parent hesitates, identify their main worry and focus on clear information. So ask them what that main worry is, and then show the parent you're listening. I can see you care about a lot about the safety of your child. I hear what you are saying. And then the clear information would be ask if the parent is open to hearing your message, address their main worry, and then clearly recommend getting the vaccine today. Next slide. So we know that vaccine hesitancy is a spectrum, and along that spectrum, we have the continuum of vaccine acceptance and some hesitancy. So we have those that accept all vaccines, no problem, and then we have those that refuse all vaccines. But in the middle, those that accept them but are unsure, accept some and refuse some, delay some, refuse but are sometimes unsure about whether or not they should be getting it. Those three in the middle really do outline those patients that experience vaccine hesitancy or parents of children who are hesitant to some vaccines. Next slide. All right. What better way than to arm you with facts and data? So let's say that patients or parents' number one worry is the HPV vaccine is not safe. They've heard this myth going around. Give them these facts. Over 500 million doses of the HPV vaccine have been distributed worldwide, with over 135 million doses in the US. Studies continue to show that HPV vaccination is safe. And then overcoming that hesitancy. This vaccine is one of the most studied medications on the market. The HPV vaccine is safe, just like the other vaccines given at this age. So there you have it. And we know in the background, immunization safety is monitored by VAERS, and there's constantly data out there to be able to show that these vaccines are safe. Next slide. Maybe you have that first patient and they have a son and they're saying, well, HPV vaccines are just for girls. The fact is that both boys and girls are exposed to HPV. We saw in one of the scenarios that there are 6 cancer-causing strains, and 3 of those affect males. The virus can cause cancer and many other diseases in people of all sexes. HPV vaccine is recommended for all adolescents since both men and women can get HPV cancers. And helping patients overcome that hesitancy with a statement such as, HPV infections don't care about gender. The virus can cause cancer and many other diseases. Next slide. Myth number 3, the vaccine has harmful ingredients. HPV vaccines contain ingredients that have been proven to be safe. HPV vaccines contain aluminum, which boosts the body's immune response to the vaccine. The amount in vaccines is smaller than we encounter in food and cooking utensils daily. I think it's great to relate it back to something that we do each and every day. We might not even, consider as harmful or unsafe, such as eating or using, spoons and forks. But that might have some relation to how our patients respond to us. Before we move into number 4, does anybody want to share in the chat or even come off mute of a hesitancy that you might have seen with a patient when receiving vaccines?
Hi, Chantal, this is Brian. Not with HPV, but any vaccine or in general?
Mm-hmm. Any vaccine.
So, yeah, any vaccine. Yeah, one of the most common things we have, especially when the COVID vaccine came out, is people had no idea what it would do to them in terms of there was enough data. Was it safe? So it was kind of challenging because there was not much data out there. So it was essentially benefits outweighing the risk. And usually patients do, they understand, they see around them. I've had patients who have come with shingles, and they're not sure if they want to continue taking the shot. Like they took their first dose and they were not sure they want to take the second dose just because they thought that it was not useful. But we had to then educate, let patients know that it can not only just affect, it can affect your optic nerve behind your eyes. And they hear that and they get concerned. So with HPV, I had one parent about 2 years ago who asked me to produce data on whether it can produce infertility or not. And that was one of the concerns that they had. So I had to go and dig data and had to show them that it did not. But eventually they decided to go for it.
Yeah. Thanks so much for sharing your experience. Yeah. And sometimes, the challenge for us is to find that data and share it. And really, the whole point of today's presentation is to at least get you a starting point to have the facts to be able to approach it with confidence. So I see in the comments, Rick says for HPV, some parents think it's influenced more risky behavior in teens. This is a myth based on studies. Absolutely. Don't steal my thunder. We'll get to that myth. Some patients have cultural biases, such as distrust of Western medicine or healthcare providers. And I think that that's true, Marcella, for a lot of different vaccines. So great. Thanks for your engagement and sharing. Next slide. All right. Number 4, you must have sexual intercourse to get HPV. So the fact would be HPV is spread by intimate skin-to-skin contact. People who have not had intercourse can become infected. Vaccinating before age 13 provides the best protection from HPV cancers. Almost everyone will encounter HPV, and your child must be protected before being exposed. Helping them talk through or think through that hesitancy, you could use the statement, this really isn't about sex. The HPV vaccine is about preventing cancer. And that statement, I think, is the easiest one to win parents over of, would you really withhold any other cancer preventative life-saving vaccine from your kid? Absolutely not. Next slide. Myth 5, the HPV vaccine causes teens and preteens to become sexually active. So the fact is that research shows no correlation between HPV vaccination and increase in sexual activity. Overcoming that hesitancy, this really isn't about sex. The HPV vaccine is about preventing cancer. So helping them kind of, think through it a little bit differently. Next slide. All right, and we have myth number 6, HPV vaccination can lead to infertility. So Prim, you mentioned this one. In a study, the fact is that in study over 200,000 women, it found no association between HPV vaccine and premature ovarian failure. HPV diseases can harm fertility, so the HPV vaccine can actually help protect fertility. And I think that's a great starting point for patients who are hesitant due to this specific myth. And myth number 7, HPV vaccination and school requirements. So sometimes there's a lot of misunderstanding on school requirements. The HPV vaccine is required for school in Rhode Island, Virginia, District of Columbia, Puerto Rico, and Hawaii. So school mandates are based on political and economic considerations, not medical ones. Who decides what vaccines are required for school? Those are decided by the state legislature. So get involved, make sure you advocate for your profession and patients. And then overcoming hesitancies, school requirements don't always keep up with medical science. The HPV vaccine is an important vaccine that can prevent many cancers. So helping patients understand, although it's not a school requirement at this time, it really still is important to get your children vaccinated. Next slide. All right, so we have our pharmacists as our HPV champions. Be an immunization champion. You are a trusted healthcare messenger. You recommend and advocate for all immunizations, including HPV, during any parent interaction. Recommend HPV vaccination to all children 9 years old or older. Together, we will promote a healthy community. Next slide. And then we have opportunities for our pharmacy technicians to impact HPV vaccine uptake. If anybody has a specific example of how their technicians impact either HPV vaccine uptake or any vaccine uptake, please add it in the chat or come off mute. But some examples here are during pre-administration. So check patient HPV vaccine status through state immunization registry. Notify the parent or guardian that the pharmacist would like to talk to them about vaccines for their children. In administration, under 14, they can coordinate that prescription with the PCP for the vaccine order. Of course, they can enter and type up the RX label, process insurance claim, and gather any needed supplies to prepare the patient for vaccination. And then post-administration, scheduling follow-up appointments. We know that the recurring, this is a series, so they will need to come back. Documenting the doses received in your pharmacy information system, And then notifying the PCP of doses administered, which is usually, the number one ask of providers that we work with is they just want to be notified anytime that their patients are getting vaccinated so that they can update their records. Didn't see anything specific added in the chat to pharmacy technician involvement, but we definitely want to encourage it and give them the confidence as well to take part in this. And hopefully the things that we've covered today have really at least given us a starting point for some things to think about to be able to make that confident recommendation to our patients. Next slide. All right, so a few conclusions. The HPV vaccine can prevent 6 kinds of cancer. HPV research over the last 13 plus years has proven that the HPV vaccine can prevent 90% of cancers caused by HPV. HPV cancers occur in men as well as women. HPV vaccine will prevent most cancers when given before a child's 13th birthday, but can be given at older ages if a child wasn't vaccinated on time. And pharmacists are trusted healthcare professionals, and you can recommend the vaccination to customers. So hopefully you walked away from today feeling confident about returning to your practices and making a confident recommendation to your patients. At this time, I will turn it back over to Ashley and we'll open it up for a little bit of Q&A.
Perfect. Thank you so much, Chantel and Erica. It was a really wonderful presentation today on HPV vaccination facts and just different communication strategies. So we are going to do a short Q&A. I did receive some questions via private chat, so I'm going to start with those. So, Chantel, would you be able to clarify the info for receiving a doctor's script? I think.
I'm so sorry.
Yeah, no, if you could just share a little bit more about that.
Oh, sorry. I was trying to ask the question and answer the question at the same time. So in the state of Texas, we administer under physician protocol for 14 years through 26 years. And then any patient that has a prescription from 9 years to 26 years. So you can work with a provider to get a prescription for your patient down to the age of 9 years old.
Perfect. Thank you for clarifying that.
Thanks for giving me the opportunity to clarify.
Yeah, no. And another question I think this would be for Chantel. Can you share a little bit more about what it might look like for a pharmacist to actually verify and receive that script for anyone under the age of 14? I guess what might that look like, if you as a pharmacist, if you were calling a physician?
Yeah, I think it's a wonderful opportunity to first introduce yourself to providers that you likely work with. If you're somewhere where you're getting pediatric prescriptions a lot, you can even be proactive in recommending vaccines and or taking a look at having those conversations with physicians. I think for the first couple, you definitely want the pharmacist to have that conversation with the provider, just calling the office to say, hey, I have X patient here today picking up a medication, talk to his mom about getting HPV vaccination. He's really interested. Could you send a script over? Would you help us in sending that script over? And that really at least opens up the conversation. And before you know it, you'll have providers proactively sending that because they know it's available. Usually the first question is, oh, I didn't know, that's something that you all did at the pharmacy. So having that open conversation with them really does help.
Perfect. Thank you so much. It looks like we got a question, and this might be for Erica. But Daniel shared that he has some doctors sending women over the age of 45 for HPV vaccine. I don't know if you want to share a little bit more about that, and do you know maybe why they might be doing that?
I can't comment to maybe why they're doing it, but I would just say that the vaccine is approved up until age 45 per FDA. So anything above that would be considered off-label. So that physician may have a reason for doing it, but there's no strong evidence around that age group.
Yeah. And I wanted to add, just as a comment in the chat from Julie about, that age 27 to 45 is also recommended. I think today's discussion was just more geared towards pediatric patients, but we definitely want to advocate for all of our patients who are eligible to receive vaccination, especially young adults and those that need to get caught up that might be kind of in between. They received one dose or haven't necessarily followed up for any specific recurring doses.
Perfect. Thank you, Chantel. And it looks like our colleague Jennifer Conga added into the chat our ACS guidelines for HPV vaccination. We have one more question, and I'm going to throw this one to Erica. But do you know what is the percentage of effectiveness if a patient only gets one of 3 doses? Same, if they received 2 of 3 doses.
Yeah, that's a really great question. I think, from the randomized trials that have been conducted, they can look at the level of antibody titers and how well the immune system is responding to a vaccine. We have that evidence, but what's happening now are we're seeing trials come out around what one dose efficacy would look like. So those data aren't out yet to be able to know how efficacious it is with one dose. You get some protection, but it's unknown how, at a population level, what that effect will be. And then for 2 doses, we know that the immune response is robust at those younger age groups. So that's why 2 doses is sufficient for children under the age of 15. Chantal, do you want to add to that?
Yeah, I know that there has been work. I know National Cancer Institute and some others have put out some data, but again, I know that it's still a work in progress. We always say, at least some protection, but helping them get caught up, I think, is really what our goal is within the pharmacy. So if you have a patient that either can't remember or they, can't necessarily think about the last time, just make sure that you encourage them to get those catch-up vaccines while you have them.
Perfect. Well, thank you so much, Chantel and Erica, for today's
I have
discussion.
one, sorry.
Oh,
I couldn't type in the chat. I can't use the chat for some reason. There's a quick question, just follow up. So if a patient, let's say a parent comes in and says, my child got the vaccine at the age of the first one at the age of 10, and then they got busy, forgot, and after 12, they come at 13 or 14. Do they just get one more dose to complete that? Or do they have to restart? Or how does that work if they missed the window of 2 vaccines?
I believe they would go on to get their next dose at that time, but I am also not a clinician, so I don't know, Chantal, if I'm understanding the question correctly. You're saying the window is longer than the 12-month period.
Exactly.
Yeah, I think I would just go with their current age. So, based on the recommendation for the younger ages, it's 2, and then as patients get older, it's 3.
yeah, and I would agree. From all the trainings that I've had and conversations with clinicians, it's just you continue with the series that you started. So if they receive their first dose, between the ages of 9 and 15, then they would just only need that second dose. But if they started later, then they would get the full 3-dose series. So thank you all again for today's discussion. I'm going to have Hannah go ahead and share the slides, and we are just going to wrap up today's session with a few resources to support you as you go on to be HPV vaccination champions for us. If you want to go to the next slide, we obviously do want to do a quick poll. Just to see what knowledge you have gained from today's session. So these are the same questions that we asked before. So please feel free to go ahead and answer them. I'll go ahead and give you some time to do that. While you do, I will just go ahead and wrap up today's session. If you want to go hand to the next slide. So we did share a lot of resources during today's session. And we've actually organized a really wonderful resource roundup for today's presentation. And so we've added all of the links and sources from today's presentation. So we'll go ahead and send that out as well. I think Kayla's going to add it to the chat. We will go ahead and update that when we have our December session, so you have it all in one document. But this at least gives you the resources from today's session. If you want to go to the next slide. So to wrap up today's call, I do want to share just a couple of reminders. So our next session will take place on December 12th from 12 to 1 p.m. Central Standard Time via Zoom. If It's not too late to register, so please, feel free to share this series with your colleagues and your friends in the pharmacy field, and they can definitely still register for that. During the next session, we will hear from Erica and Chantel on HPV evidence-based interventions and immunization champions, and we're actually going to have a panel sharing their experiences implementing evidence-based interventions as pharmacists. So excited for that to happen. It looks like we still have about a couple of people that still need to complete the poll. So I'll let you guys continue to do that. But in the meantime, we do want to know how today went, what you really liked, and what you feel could go better. We're asking participants to complete our post-session survey to share that feedback with us and also be able to claim their continuing education credits. So in order to receive credit for this activity, the participant must have attended the CE live webinar in its entirety, be able to answer the post-test questions and receive a 70% or better, and complete the program evaluation. The program post-test evaluation link will be provided right now. You can either scan the QR code. Also, there will be a link that will be emailed to you as well. Pharmacist learners cannot claim credit after 60 days of webinar conclusion, and non-pharmacy learners will receive a participant certificate of completion within 2 to 3 weeks of eval completion. So just wanted to share that with you. If you want to go to the next slide, for those who are listening to the session in the future, please scan this QR code to receive credit for this activity. In order to receive credit for this activity, the participant must watch the content video in its entirety, answer the post-test questions, receive a 70% or better, and complete the program evaluation. The program post-test evaluation link will be provided at the conclusion of the content video and or in the comments section of the video posting. Pharmacy CE credit will be uploaded to CPE Monitor within 3 to 4 weeks of eval completion. Same with our live learners. Pharmacy learners cannot claim credit after 60 days of webinar conclusion, and non-pharmacy learners will receive a participant certificate of completion within 3 to 4 weeks of evaluation completion. And this session will be available for continuing education from December 3rd of 2024 and through December 3rd of 2025. So just want to be sure to make that aware. And then if you go to the last slide, I want to thank everyone for joining today's session, and we look forward to seeing you just in a few weeks. So thank you all again.